It's just because I need to. Are we live?
We're live.
Okay, it is Friday, April 15th. Our devotional today said a lot of things about April 15th. I mean, it's Passover begins, it's Easter, Good Friday, it's Ramadan, the middle of Ramadan. Passover is also tax day. So welcome to April 15th.
It's also the day that they honor baseball. Never mind.
They honor what?
Jackie Robinson Day.
Oh, Jackie Robinson Day. Okay. Okay. Good to know. Okay. So we're going to talk a little bit about particularly today about the fund for $400,000 and how we get that out into and if there are other things. We did turn in a request, an EMS request to the Appropriations Committee. And that guy bring back your copy. We turned in a request of $950,000. I have no idea how much of it got into the budget, but it was $450,000 for initial EMS and upgrade education, the voucher program. So it was EMR, 100 students at $350 each, EMT, 250 students at $1,000 each, and advanced EMT, 110 students for $1,500 each, and then $300,000 for paramedic education reimbursement, $100,000 for EMS courses in underserved EMS districts, $37,500 for critical care pandemic education, and $62,500 for EMS continuing education to work on the statewide virtual education and the continuing education and leadership development. So that's what we turned into the Appropriations Committee. And I can, if I went really fast and you don't know, I can email to you what we turned in, if that would be helpful to anybody to see. And they have not voted out the budget bill yet. They're going to do it this afternoon. So I don't know how much got in there. I'm hoping the whole 950,000 got in there. And I believe that was the only request for money from this committee, other than what was already in bills that the House had put in the, isn't that right? I mean,
So I can't do anything.
I don't think of anything else. So some committees were getting like $100 million. So I don't feel bad about this. Anyway, is Drew joining us?
He just entered the waiting room.
Oh, good, okay. Oh, Drew, are you in your car?
He's muted.
Either that
You're
or his
muted.
house is a pretty funky looking place.
So, Drew, I just did a very quick walkthrough of what we turned in for the request for EMS services, the 950,000. And we turned that into the Appropriations Committee. So I think that really what we need to do today is to figure out where we are with the 400,000. And then if there's anything else we can or need to do right now to help EMS, if there's any, anyway, so do you, I think what we'll do is maybe start with Dan. Do you want to talk to us, or Will, do you want to talk to us about the 400,000, and you were going to come back with how you were going to get that out? So thanks.
Thanks, Madam Chair. I'd like to yield my time to Will, if he's got the bigger plan. But before I do, I just wanted to say thank you for your ongoing support of EMS. It is not lost on me how important this is, and we appreciate all your efforts. But Will and his team have been working furiously to construct an appropriate plan, and they've done a masterful job. So rather than me try to translate it, I'd rather just push it right over to him.
Sure, that's fine. And I will tell you that we have done things. I wish we had been able to do a lot more around reimbursements and the level of reimbursement and what your reimbursed for, and also continuing to get people to think about EMS as part of the healthcare system and as kind of an extension of hospitals and medical practices instead of as a transport.
They say that politics is the slow boring of hard boards. So I will I'll look at it as a long-term project and look to help you work on that in the future as well.
Good, thank you. Okay, so Will, would you like to talk to
Yes,
us about this?
Yes, Madam Chair, thank you for the opportunity. So over the last several weeks, my team and I have worked closely with Director Batesy. We've carefully consulted with our business office here at the Department of Health, and we've also worked in close conjunction with the EMS Advisory Committee to come up with a plan to spend approximately $572,500. So that is the unallocated portion of the EMS Special Fund as of late March. So here is an overview of our plan. So we've identified 4 distinct buckets that we would allocate these funds towards. The first is focused on initial EMS education, and we've allocated $350,000 to that program. Within that program, we are targeting EMR, EMT, and advanced EMT courses. Under the EMR heading, it would be 100 students at $350 each. We would target 150 EMT students at $1,000 each. And we would plan on training 110 advanced EMTs at $1,500 each. The next area that
can I just ask you a question? Is this, because that we turned in a request of $450,000 to appropriations for that. So this would be in addition. So we were really talking here about the possibility of 200 EMR students and 500. I mean, if both things got funded, if you put your funds out and they funded it. Okay, great. Thank you.
Yes. Okay, so that's the first area that we're going to focus more than 50% of the unallocated portion. The next bucket is going to be EMT courses in underserved EMS districts. So those EMS districts that have historically had difficulty accessing initial education programs, specifically EMT programs, and we've identified 4 EMS districts around the state, and each of those districts would receive 20 fully paid slots in EMT programs. So it's 80 students total and 20 in each of those districts. Now we've allocated for each of those students an amount of $1,250, as we recognize that because these are underserved areas, that for those educational programs that are looking to bring education to those more remote areas of the state, that is likely going to come at a higher cost. So we've appropriately adjusted the amount to reflect that. And the total for that area is $100,000. So $350,000 for initial education vouchers. And then for the underserved EMS districts, it's $100,000 as well. The next area that we want to focus funding on is critical care paramedic education. Certainly over the course of the pandemic, it was clear that there were too few critical care paramedics available across EMS services that provide interfacility transfers. And we recognize that more often than not, services have to send their paramedics out of state to receive that education. So our goal is to bring critical care paramedic education to the state. And our plan calls for holding 2 classes, one in the north and one in the south, with a total, with the goal of training a total of 50 students. And that would be the amount we've allocated for each student slot is $1,250. And the total allocation for that bucket of work is $62,500. The last area that we want to focus a portion of the unallocated portion of the special fund is in EMS continuing education. We've set that amount at $60,000. And we have several programs that we want to fund utilizing that $60,000. We're looking at allocating a portion of that $60,000 to the annual EMS conference, which is for a lot of EMS practitioners around the state. That's the conference they plan on attending to gain the continuing education credits that they need to recertify with the National Registry. We also want to spend a portion of that $60,000 on statewide virtual education. We've seen across several of our programs that when you make that training easily accessible in the virtual setting, that we have really outstanding levels of ongoing attendance. And I would certainly sing the praises of our EMS for Children program, where they routinely have upwards of 200 people attending each of those virtual trainings. The third area of work within the continuing education area we want to focus on is continuing education for our EMS educators. We really rely upon those folks to not only bring folks into our system by offering classes, but they are really on the front lines of our education system, and they're supporting those folks who are budding EMS professionals and shepherding them through the process of education, which ultimately leads to certification and to licensure. And to make sure those folks have the most up-to-date and modern educational tools, we feel it's important that we invest in their own education so that they're up-to-date and ready to meet the needs of the students that we have today and tomorrow. And the last area that we want to focus on within the continuing education realm is leadership development. It's very common across services around our state that folks are put into leadership positions with really very little preparation. And so we've looked, and we are currently looking and have looked at several opportunities that we have to provide those folks both the tools and the knowledge they need to be successful in their roles. So when you add those four key areas up, it reaches $572,500. Which accounts for just about every dollar. I think there might be a couple of dollars I haven't accounted for there, but we are pretty darn close. What questions can I answer for you?
Well, I guess my first question is, my first comment is that I think that clearly you've been working along with the council. I can't remember what it's called now, but the EMS Advisory Committee. Right, because their concerns in their areas of interest are the same as what we turned in. But so it is exciting to think that both would be funded, because that really is putting some into the, probably still not enough, but at least it's moving in the right direction. My question is, now that you've figured out the money, how are you going to get it out, particularly to those four areas? Are they going to have to pay for it, then reimbursed? Are you going to just send them the money? Are you going to call them up and say, hey, we've got money here for 20 slots for you, and just what's the process for getting the money out?
Yeah, Madam Chair, I think that's a really great question. So let me just talk about the voucher program first. So in the EMS education voucher program, our intent is to have a period of time, so several months, that every first response and ambulance service has an opportunity to take advantage of what is allocated to their service. So statewide, there are 168 EMS services. It's a combination of both ambulance and first response. If we divide that 350,000 by the number of licensed services, it comes out to approximately $2,000 per service. Now that doesn't seem like a lot, and I think we can talk about the importance of the other money that you communicated to us today that you've allocated or recommended, makes its way into the budget. So our plan would be that we say to every service, you have a window of time to let us know how you would like to spend your portion. You have $2,000 to spend. You can train, 20 EMR, or you can train, 6 EMRs. You can train 2 EMTs, or you can train, 1 EMT and an advanced EMT, but you might be responsible for the last portion that we don't have funds available to pay for. But ultimately, we're going to have a period of time where every service has fair and equitable access to what they're entitled to within that unallocated portion, specific for the voucher program. After that period of time, as we're rapidly approaching the fall courses, and we typically see the majority of courses start between August and September, for those services that don't have staff to put into those slots to take advantage of the voucher program, we would then open it up to the entire, to all the services out there, and whatever money is left over, we would make that available. And our goal is to spend every dollar that we've allocated in the voucher program and to identify, potential EMT, advanced EMT, and EMR students, and do our very best to spend that entire allocation of $350,000. When it comes to the underserved EMS districts, our intent is to look around the state to identify those education programs that intend on hosting EMT courses in those specific areas, and then communicating with those educators to say, we would like to purchase 20 seats in your class. And then those EMS services in that particular district would have a fair and equitable way to get their students into the course. So we're not asking anyone to put any money up front. Like the voucher program, we would be making direct payments to those educators. Our goal is to be able to say to those folks who are hosting these education programs, we see that you're planning on hosting a course in this area. We think that's great. We'd like to go ahead and purchase 20 of those seats. And that provides the green light for those services to go ahead and sign their staff up, and there's no cost passed on to the service, up to the amount of $1,250. Did I answer your question adequately?
Yeah, I think so. And I just wonder if, in terms of getting, helping to distribute it in a fair and kind of equitable way, if the advisory council has any role to play in that, since they represent every one of the districts, if they can, and I don't know, I guess that's more a question for Drew and Jim about what their role might be in helping to make sure that the money gets where it's going to be the most needed, as opposed to, because I know often in many programs you have real go-getters in some agencies and some towns, and they're right there applying for the planning grant or whatever it is, and then the poor little town that doesn't even have an administrative assistant, they just have a select board of 3, are kind of left in the dust. So I just wondered if the council would have any role to play in helping with that. What, Jim and Drew, what do you think? Or is it?
Well, I hope the advisory council does, and I'm sure there'll be plenty of questions as it goes forward. They want to spend the money. So the question first I have is 570. We had the districts that set up their courses before. Is that, and like the past funding I've sent in for our application for it, is that still going to be done?
Yeah, so Jim, great question. So the 572,000 represents the all of the years in the past, and that's those are the dollars that have gone unallocated to districts. For those districts that are in process applying for applications, or for the current grant year, so 2021 and 2022, That money has remained separate. So that is not included in the 572,000, as it is still important that we provide the time EMS districts need to take advantage of the money that's allocated to them within this current grant year.
The only other question I have is we're going to work this through the advisory committee and help make sure the application process is done, I'm sure. But do you still have on the state side the money for paramedic course? Will that be for courses that are other than the Vermont course?
So the only money we've allocated towards paramedic education is specifically for critical care paramedic education.
I was talking about the money they put in the budget for the,
Oh, you mean the money that we put in?
yeah,
Um,
it's 30,000 versus 9. So we were trying to get more in.
for, which did you ask again? Which, the paramedic education reimbursement?
Paramedic, like last year, they tried to give it all to VTC and it didn't get all spent. And we wanted to make sure we're able to get the best bang for our buck so we can send them to other courses.
Yeah, it wasn't specified in what we turned in. We just asked it to be put in the budget, and the 300,000 for paramedic education reimbursement, and it was up to $15,000 each, and it doesn't specify where that should go. So it isn't going to any particular institution. It would be going to the person themselves, is the way I understand this.
Thank you. And I appreciate the work you're doing, Will, and the crew too.
Thank you, Jim.
Brian?
Yeah, thank you, Madam Chair. So that's really good news, Will. I mean, I had notes that it was 400 grand and all of a sudden it went to 572. So you must have lifted some rocks and found some other coins there, and that's good. And if I did the rest of my math right, and assuming that in our Senate Appropriations Committee in the next next room, they're going to vote the budget out 13 minutes from what I understand at 2:15. If the 950 that we've asked for can be added to the 572, at one point it sounded like you were reading from the list of what we had asked for, because you broke it down the same way and the amounts were so close. Anyway, it added up to about 1.5 million if you take into account both of the funds, if you will. And so I got to think that that's a pretty good deal. If you look back 3 weeks ago, we had zero. And so we've come a little bit of a way along the path here. So thanks for finding that extra money. I don't know where it came from, and I don't care, but it's a good thing that we did that.
Well, I will say, I think Drew has his hand up, but I'm going to say, Drew sent this list to me and we got it in just in the nick of time. Yeah. And it was, it is clear that the department is working with the council, because they were the same areas of concern. So yeah. Drew, did you have a comment?
That was a comment I wanted to make. Is we've been working extremely close with the EMS office on what the educational needs are, short term and long term, which is why you see such similarities between what I presented to the committee as well as what you're seeing from the health department. And moving forward, as we look at putting those classes together, targeting that education towards underserved areas, or kind of getting that voucher program up and running, I think this collaboration will certainly make sure that those dollars get where they need to get.
Good.
The only thing I would suggest also is that we make sure that you stay on top of this for next year and getting the money out, so that we don't end up in 3 years with $400,000 unallocated because people couldn't figure out how to get it, or how to access it, or how to get it out.
Yeah, Madam Chair, and thank you for I think raising that point. And I think this is a really important step forward for us, laying the groundwork, and it defines our process that once we reach the end of a special fund grant period, we now have a defined process in place for how we can expand or contract this type of plan to mobilize those dollars that have gone unallocated. You know, we can take a portion of it and assign it and allocate it towards a voucher program, and we have a process worked out with our business office to do that. And we can apply that same methodology to continuing education, critical care paramedic education, and bringing education to those EMS districts that have been historically underserved. So we hear you loud and clear, and we are committed to ensuring that we do not encounter this problem in the future.
Good.
Great, great. So Gwen, did you want to make any comments?
No, I'm just here to listen, and I concur with pretty much everything that's in the report anyways, because I'm on the advisory committee. So yeah, nothing to add.
So we don't have much time left up here right now. We're kind of getting closed down. Is there anything else that we should be doing around EMS this year that we can, anything that we should try and find a vehicle to put something on, or I mean, is there anything else you can think of right now that other than changing our whole reimbursement system, which I don't think we can do in a week, but are there other things that we can do right now? I guess
not.
Madam Chair, I think that is really it's a great question, and I appreciate you asking it. You know, I think we could probably take a fair amount of time to talk about those areas within the EMS industry that we have inherent weaknesses, and I think if we're able to achieve what we've outlined today and what you have requested, you know, find its way into the budget, I think that will really go a long way to addressing those problems that are really the most pressing for EMS services around the state. You know, workforce, recruiting folks into our workforce and sustaining that workforce is likely one of the most pressing problems that we have today. And I applaud the time and attention this committee has put on that topic and helping us address those concerns around the state. And there's no doubt that if all of this comes to fruition, you know, this will leave and have a positive impact on every service across the state.
Good.
So thank you.
So I just had an interesting thought. You know how you were talking about how a lot of the hospitals are using your providers, your personnel, because they've been so short of personnel. And I don't want to ding the hospitals, but then people are sometimes then leaving your service and getting on the staff at the hospital because they can make more money. So in the business world, if you hire a temp through a temp agency, which is what the hospitals are doing with your personnel, and then that temp person gets hired by the business, they have to pay a fine to the agency that they got maybe the hospital should be paying you for poaching your workers.
Yeah.
I don't think that would probably go over very well with the hospitals, but it is something to think about.
For sure. And you know, I can add that, you know, EMS has historically, we've had a lot of success in recruiting a lot of budding healthcare professionals. And they often look to EMS as a real opportunity to gain both time and experience working within medicine before they move on to their and to find ways to achieve their higher aspirations. You know, our goal is to continue to recruit really good folks, but ultimately we'd like to look for innovative ways that we can offer folks the opportunity to stay within EMS and to look at EMS as a long-term career opportunity and not just as a stepping stone. So perhaps in the future, that's where our conversation can go next. And, you know, what opportunities are out there for us to support our services in not only recruiting, new EMS professionals, but in retaining the workforce that they have today.
Yeah, and I think another problem that we see is that much like the sheriff's offices that just get some core funding and then they have to go get contracts from towns to I don't know if all the services do this, but I know rescue, that's what they have to do. They have to go to each of the towns and get a contract an appropriation from the towns. And some towns get their, get a little upset at some times and they say, we're gonna withdraw from this. And so then it isn't,
Stability.
it is unstable, yeah. And I don't know how we address that, but we had the fight in Putney, Drew, was it 4 years ago, 5 years ago?
Yep.
When some people got a hair about rescue and they wanted to withdraw, and fortunately the town didn't, and now Brattleboro just did. And so I don't know how you address that, but maybe the hospitals should have a line item in their budget for EMS services to support them, because they are an extension of the hospital. And I am suggesting that to the Green Mountain Care Board.
That's a good idea. I mean, an essential service that's saving people's lives should not be something that's held to the whim of like looking for contributions from local communities. That's gonna make sense.
It's probably not a good time for people in Rutland to be putting it on the Rutland Regional Medical Center, though. They're already $7 million in the hole, so
Yeah.
unfortunately.
Well, and it certainly wouldn't happen this year because they've all done their budgets anyway, but it is something that the
Yeah.
Green Mountain Care Board should look at.
Yep.
About should hospitals have a line item for the services that provide.
Well, somebody agrees.
Who was that? Was that you, Drew?
No,
No, that is one of my dogs. I apologize.
Oh.
They
Drew?
apparently agree with you. Yes.
One of the conversations that I've had with other administrators and certainly regulators is the concept of what is licensing ambulance services in Vermont based on. And one of the considerations maybe is, should there be a process of getting a certificate of public good for ambulance licensing in the state of Vermont, or should at any point anybody that wants an ambulance license able to just get an ambulance license and start an ambulance service in Vermont, which is the way it is now.
Yeah.
And critical service, does it make more sense to have a little bit more scrutiny on how that happens and what the overall effect on the community and the region is?
That's a great idea. And it could be either a certificate of public service or certificate of need. I mean, medical facilities have to get a certificate of need. So, or a public good. Electric company, I know, like Vermont Yankee had to have a certificate of public good, but hospitals have a certificate of need. So, but that's a great idea. Maybe we'll include that in the request to Green Mountain Care Board, that they look at that. Because, yeah. Anything else you can think of?
Any other suggestions at this moment? But thank you for asking.
The big discussion I would like to have at some point is really unpacking the long-term financial sustainability through fee for service. And I know that's way too much to unpack in the last week of the session, but really, in order to come up with long-term sustainability for EMS in Vermont, we do have to come up with a funding mechanism that is sustainable for the delivery of service in Vermont.
Yep.
Well, maybe that's something that we can tackle over the summer, fall, and come in with some recommendations for whoever sits in this room next session. I mean, I think that could,
Yeah.
I'd be willing to work with people on that over the summer, fall. If you want it.
I think that would be great.
Yeah. If you want to set up some kind of a group to work on that. I don't want to make it a legislative committee because we don't need any more legislative summer study committees, but if we could do something, if you could set up something, I'd be willing to work on that. And I don't know if other people would or not, but to try to figure out some alternatives for funding here.
We'll set that up.
Okay, great.
Thank
Anything
you.
else? Oh,
Thank
did-
you all for your hard work and supporting EMS. We appreciate it every year. Thank you.
Thank
Well,
you.
thank you.
Thank you.
Yeah.
And I'll tell you, this committee got involved with it because Drew is so persistent.
Mm.
He just would not quit. And I think that's how we started getting involved.
Persistence, the nicest thing I've been called all week.
Well, I could say some other things too, but I won't. So, well, thank you, everybody, and thanks to the Department of Health too for
Yeah,
the
thanks.
work that you've been doing.
Have a good weekend.
Thanks a lot.
Thank you.